My name is Noah. I am the director of the Transit Access Project, and I'm going to be talking about our cost-free public transportation for youth experiencing homelessness pilot. I'm going to get right into it because I have a lot of ground to cover here. So, when it comes to youth homelessness in Toronto, nearly 30% of all people experiencing homelessness in Toronto, sorry, the bottom of the slide should not be that color. I'm not sure what's going on there, but nearly 30% of people experiencing homelessness in Toronto are youth. And when it comes to breaking cycles of homelessness, for youth experiencing homelessness, early intervention is essential. The longer that youth remain in cycles of homelessness, the more likely they are to experience long-term entrenchment in homelessness and recurring homelessness throughout their lifetime. So a question that you then have to ask with a city that is as large as Toronto and has quite a bit of service diffusion throughout the geographic space of the city is when it comes to availability versus accessibility, trying to get youth rehoused isn't an issue of what services are available. It's often an issue of, can they access those services? Do they have the mobility to access those services? So, oh, there we go. In Canada, the first research that looked into this issue was in Edmonton in 2013 by Stewart et al. They were the first group of researchers to study cost-free public transportation as a homelessness-specific intervention for youth. So they provided initially 40 youth with cost-free monthly transit passes for 3 months. Non-payment of fines for fare evasion in Edmonton had massive tickets at the time of $250, and non-payment of those tickets could lead to a criminal record. And for many of the youth in this study, that was their first interaction with the criminal justice system. That was the beginning of their criminal record, is through just not having $3 to pay for their pass. So that is incredibly inhibitive when it comes to the rehousing process, because it means you lack access to, say, employment, education, other opportunities due to that criminal record in the future. So this intervention looked at how free public transportation impacted safety, social inclusion, rehousing, employment, social service access, and also interactions with transit authorities and ticketing. So in this initial proof of concept pilot, they saw positive changes in almost all of these areas. This then led to a pilot project of 100 passes for 6 months for all people experiencing homelessness, all ages, which was then scaled to a systems-wide program of cost-free public transportation for all people experiencing homelessness. This was distributed through the shelter system. Nearly 600 passes now are distributed every month, and it's seen continued success in increasing financial stability, access to support services, employment, rehousing, decriminalization for the people accessing these resources, meaning greater financial autonomy and rates of rehousing, and reduced costs for services that would be put towards supporting these individuals, and then also reduced cost of hiring judges, lawyers, all these things to process these criminal trials, meaning that there was a great social return on investment seen in the study. Every dollar invested, there was $1.92 saved system-wide. So that comes to us. So the Transit Access Project was initially a volunteer initiative started by 5 undergraduate students, including myself, at the University of Toronto's Engineers Without Borders student chapter. We wanted to test this same intervention, the initial pilot intervention, to see how the efficacy of this intervention translated to the local context of a different municipality. There's going to be different interactions between institutions, transportation, location in this city. So we wanted to see how it would fare and if it was helpful in the same way. And we began our organization in 2019, and we're now our own independent grassroots research organization. And we are partnering with all the people I've listed here, including Metrolinx, the TTC, the City of Toronto, and the Toronto Shelter Network, among others. And we are now running, or we have just finished the intervention phase of this project. So we are researching similar areas of interest, how free public transportation impacts safety, social inclusion, employment, rehousing, interactions with transit authorities. And we've given free monthly passes for 3 months to 36 youth across 3 shelters, and then some youth who have also been recently rehoused. So we're doing pre and post intervention focus groups, surveys. And we also actually are able to track the use of the Presto passes, like the monthly passes, through registration onto just like the user interface. And then we also have a data sharing agreement with the TTC. So we are able to, through consent of our participants, actually track the frequency and range of transit use and how it varies pre and post intervention using pre-intervention travel diaries, which is very interesting. Not something that we have results on yet because we just finished our intervention. So I'm just talking preliminary findings today. So an interesting feature of the design of our project is that we have engaged with shelters at varying levels of resource intensity and throughout different stages of the rehousing or service provision process. So a very short-term emergency shelter, medium-term, a long-term transitional housing organization, and then those who have been recently rehoused from that transitional housing organization. So these organizations are also distributed throughout Toronto in different areas and are all serviced by different modes of transportation. So bus and subway, or subway and streetcar. And then each institution also has separate availability of transit-specific resources. So the Transitional Housing Organization has tokens always available for essential trips, meaning non-social engagements. So like employment, school, appointments. Same can be said for our short-term emergency shelter, but because they have limited ability to pay for these resources for their residents, they just have a limited budget for this. If residents are on Ontario Works or any sort of wage replacement, whether that be employment insurance, ODSP, they no longer are able to receive these tokens. And then for our medium-term shelter, there are no tokens available whatsoever. But letters of residency, meaning they are given a letter that just says, my name is blank, I am a resident at this shelter, please let me use transportation, I don't have the funds. Those are given to residents as an informal fix because they lack the ability to give their residents resources to access transportation. So this was one of the most kind of stark findings of our initial focus group phase. The letters of residency are an incredibly stigmatizing resource, even though they are a better resource than offering nothing. When it comes to access to mobility, if you don't have organizational resource and you don't have individual income, your only option then is fare evasion. Fare evasion is incredibly mode dependent, though, as to how reliable it will be for you to be able to access transportation based on the mode. So for streetcars, there's no attendant. For subway, it's very easy to fare evade. But most participants who said that they regularly fare evade said that they also regularly are honest with attendants and just ask to go through without fare. When it comes to having those conversations on the bus, in having that conversation, you are outing yourself to the entirety of the public on the bus and also stopping the mode from moving forward as you're having this conversation with the bus driver. So the subway, this conversation is had in a liminal space, but this means that drivers also have discretionary ability to enforce fare. So these instances of having these conversations are incredibly stigmatizing and can mean if where you are trying to get to is predominantly serviced by bus, you do not have consistent ability to get there, whether it be because you lack funds, don't have a mobility resource from the shelter that you're staying at, or cannot evade fare, or the letters of residency are not working because the bus driver is not letting you on. So this all also intersects a lot with profiling and identity, which I'll talk more about in a second, but yeah, I'll move on. Anyways, so we have these three realms of sources of mobility: organizational resources, personal finances, and fare evasion. And all of these things greatly impact quality of life. These are all of our findings from our focus groups to this point. Inability to consistently access public transportation means inability to keep employment or access new employment opportunities. We had a lot of residents reporting that they had lost jobs or been unable to get to interviews because they were unable to use public transportation. And then access to essential services were limited. We had participants stating that they had chronic illnesses that they were missing appointments for, doctor's appointments for, because of lack of transportation. And then social inclusion, both through this alienation that occurs through having to out yourself to the bus driver and the public, but also participants regularly said that they reduce their frequency of seeing family and friends who are outside of a walking range because they have to save money for fares to more essential trips like school, like work, like these appointments. So all of this source of mobility, all of this access has impacts on quality of life. All of this also has a dialogue with safety and social inclusion. So of course, time and place are relevant when it comes to safety, but interactions with transit authorities not only are an incredibly stigmatizing and mentally taxing experience, but it also outs the homeless, the youth that we are working with, those experiencing homelessness, to the public as being vulnerable, leading to greater vulnerability to predatory interactions with the public. So this also interacts with race, gender, and being visibly homeless. This means that the youth have regularly reported feeling more likely to be denied getting on the bus if the bus driver can tell that they are homeless. And then, of course, this all has interplay with mobility. Participants have listed being or shared experiences of being assaulted on public transportation due to this vulnerability, meaning that they are less likely to want to or able to use public transportation because of this fear and these past instances of trauma. And then this all, of course, affects quality of life. So we are still processing all this data. We have just finished our intervention stage and are now starting to process our recurring survey, our longitudinal survey. We had a pre, middle, and post survey. But these are all of the most obvious trends that we found to this point in the survey. And they really mimic the outcomes of Stewart et al. In Edmonton of their proof of concept study as well. We've seen strong improvements in feelings of housing security, financial security, ability to find employment, social connectivity, belonging on public transportation and generally in public and in the city, and then safety on transit as well as perception of transit authorities. Specifically with police and subway attendants, there's been a small improvement of perception of bus drivers, but it is not statistically significant. So all of these positive outcomes are showing a similar ability to aid in early intervention or aid as a way to create an early intervention and break cycles of homelessness simply through allowing youth to access services that already are available. We're not offering anything new here other than the bus itself or the subway or the streetcar. So in this way, it is an incredibly low cost anti-poverty intervention. So next steps are, so we are completing our first intervention and publishing our findings, but we have now seen that there's this like great variability of access due to mode availability for shelters and then also organizational resources for shelters. So we are working with the Toronto Shelter Network to distribute a survey to the directors of all the homelessness agent or all the shelters within Toronto, which is 140 plus shelters, to look at the association between mobility, service intensity, geography, and availability of transit-specific resources. And then we're also collaborating with the city and Metrolinx and the TTC, the Toronto Transit Commission, to work on a runway towards structuring a pathway for the expansion of this project towards a phase 2 where we are having a scaled pilot. So this is all been done by, it's all been a youth-led organization and a youth-led research initiative. And we've now, expanded beyond what we could possibly have imagined at first, but this is where we are now. So that's all I have in this presentation. I'm wondering if anyone has any questions for me.
Great. Thanks for telling us about this. Sounds really great. So yeah, what questions do we have? So one question I had, so I'm the economist in the room, so I get to ask the annoying questions. I wasn't clear. Do you have a control group? Is this based on before or after, or is there a set of people you followed who didn't get the intervention that you're comparing things to?
Yeah, so because we initially were doing this incredibly cheaply by just kind of like scrounging enough funds together to do this initial pilot, we have no control group, but we are doing before and after. So we have pre-intervention transit use data. So we had pre-intervention travel logs, and then also surveys and focus groups. And then we have a longitudinal survey that was pre-intervention, midpoint, and post-intervention, or at the end of the intervention. As well as now we are completing post-intervention focus groups and individual interviews to kind of see how this intervention has impacted ability to access all of these various services.
Okay. Yeah, my follow-up question was going to be, I imagine the homeless population is hard to follow up with, right? That they're a transient group.
Yes.
Has that been a challenge, or has it worked out well because you're providing them bus passes so they come back to get those?
Yeah, so we are offering incentives for like every point of contact they're having with us, besides like emailing them to schedule when the focus groups are. But we hope and have seen pretty low rates of attrition in that way. And also, so we are partnering with these 3 shelters, and we are working with like one intervention worker at each shelter that is kind of our liaison within the shelter. And so they keep close contact and are able to, if the youth have not moved on to a different organization, like remind youth or just be the one to kind of interact with the youth at the shelters. Also, for COVID reasons, we can't actually, and policy reasons within the shelters, we can't go in and actually be doing the research in person ourselves. We have to be doing it through an intermediary. And so that is helpful in following up, but we've seen pretty low rates of attrition generally. I think like less than 15%, which was far better than Stewart et al., like the project that we are replicating.
That's great.
Yeah.
Matthew, you had a question?
Yeah, I thought about that previous study, that statistic they had that for every dollar invested, 1.92 is generated is, I think, very powerful and important for helping to bring policymakers' attention to this. Do you have plans to do the same kind of analysis, or?
Yes.
Great.
Yeah, so a part of our phase 2, our scaled pilot, will be collecting a more expansive set of data, as well as having an outside consultant analyzing and interviewing the youth and the service providers to do a similar social return on investment study. So yeah, that is definitely in the cards for us. We know that ultimately, to scale this intervention to like a system scale, a part of the argument that we need to present is a business argument. And so we are discussing a lot with the TTC how actually these interactions between youth, especially on the bus, are causing service service delays and like just worsening customer experience, because no one wants this to be a part of their commute. No one wants this to be something that is a part of the system baked in. And then on top of that, it is also asking bus drivers to be policing fair, and that's not necessarily something that is advantageous for the mental health or just like the ease of the job for bus drivers. So that's all something that we're kind of discussing. Huida?
Yeah, thanks, Emma. This has been great. I'm from Edmonton, so really glad that you're able to get some benefit from some of that work that's been done. I was almost just going to talk about what you just chatted about, which is like maybe getting some feedback even from the transit agency and the bus operators about how like this pilot can impact their quality of work, like in terms of making it better. As you say, those problematic interactions must be stressful, not only for the homeless youth, but then also for the bus driver. And so if you can sort of demonstrate that there's sort of multifaceted or multiple benefits that are derived from this, like, I think that's great.
Yeah, for sure. Yeah, and that, I know I kind of like breezed through the next step slide, but that is a part of the feasibility study. We are wanting to like bring in the fare enforcement officers and the fare enforcement like sectors of these transit agencies to kind of discuss the nuances of this and discuss how this could actually make their job easier as well. But yeah, I totally agree with you. And also I was very excited to hear that we had someone in Edmonton in the room, because yeah, the work that's been done in Edmonton is like foundational to our work, of course. So yeah, I love Stewart et al. I love the Edmonton transit system. Big fan.
Thanks.
Anyways, does anyone else have any questions for me?
So we actually need to wrap up.
Okay.
So we have 1 minute left before we're going to be called back. So thank you again to all of our presenters, Noah, Carrie, Maria, Angela, and Sean. We really appreciate you taking the time to tell us about the cool things you're doing. So thank you so much. And hopefully we can continue to build on all these successes with things in Canada. So thank you.
Thanks, everybody.
Thanks, all. Take care.
Thanks. Bye.